Excellent. All right. Well, we are going to get started. The two things that Terry and I want to cover today, we were going to go through the key messages that were, I don't know when they came out, a month or 2 months ago, maybe. Just look through them because I don't think we've done any sort of structured review of the key messages. We just got them out to you guys and let you know they're available. So we'll go through them and answer any questions you may have, and we can talk some more about how to use the key messages, what we'd recommend, what we don't recommend for their usage. And then Terry is going to we had invited SE2 to come on the call to talk about the point of sale toolkit, media toolkit that they're developing. But Allison had something come up. So Terry has some of Allison's notes. So he's going to give us an update, I guess, Terry, on the media toolkit. And,
yes.
Yeah. So before we jump into all of that, is there anything anyone wants to bring up as far as a recent, a new update for any of your communities or any of your work, or a challenge or a question you want to throw out to your peers here?
Can you hear me?
Mm-hmm.
I just wanted to tell you that Golden did another compliance check last week and caught another retailer. So hopefully we'll have another suspension coming up in maybe a month. Yeah. It wasn't the same one, so it won't be 21 days, but a 7-day suspension, hopefully.
Wow.
Yeah. Good stuff.
Yeah.
Really quick
And
question.
Edgewater's making plans to do their first compliance check.
Really quick question. Who did the compliance check? What agency in Golden?
The police department.
Thanks.
So
That's really exciting. That's really, really exciting. I mean, I kind of feel this, from the broader perspective here, that there's some momentum that's being built around retail licensing, and the fact that, when we can revoke or suspend a license, that we're going to make a difference here. So that's very exciting, and congratulations. I know, Tracy, you didn't go in and do it, but,
No, and hopefully they'll keep doing it.
yeah, I'm hoping that this starts in a feedback loop where the police see when we do these checks, we actually do find non-compliance, and it is beneficial for us to slap them with a suspension and promote that to deter others or to promote others to really check those IDs.
Sure, but they're hoping for 100% compliance. So I think they are conflicted, and that's why I'm just fingers crossed. They'll keep doing it. We keep, offering to support them however we can. But
are they educating or doing any sort of notice to the about
we will be
checks happened? And
yeah, so we're making some new materials for Golden. Once they approve those, then we'll start doing education to all the retailers in Golden again.
Any sort of media that goes out about it?
Well, we did last time, but It wasn't actually, honestly, it wasn't very timely. In my opinion, we didn't do it right away.
Okay.
But we did do it. It was good local coverage. I mean, we didn't get TV or anything, but print. So no plans to do it again this time, but we haven't really, it just happened. So.
Right.
Well, it would be great if you guys had an opportunity to take a lead on that, some kind of media. And then, I've been trying to walk it around the state office here to really get some kind of follow-up to the work.
That might be good.
And then also to your education point, Sally, Casey, and Kristen, and several of us from the state health department, FDA, and others have been working on an online retailer education module. And so, offering that potentially July timeframe, offering that as an education tool might be useful, and helps the health department to not only be seen as helpful in the community, but also sort of like let's really push this education piece. So that'll be coming out soon.
Okay.
Yeah, Terry, I heard from my chamber contact that something like that would be really useful.
Good. Yeah, that's Sally and that team over there do such a great job with the online modules, and have, really built a great set of tools. This one equally, it has 3 parts really. Well, a 4th part if you consider what the local ordinance, the local flavor web page, whatever, you can link to this eventually. So it focuses on why we do this work, what the state law is, state laws are, and then federal laws as well.
And it's going to have sort of branded swag that goes along with it. So there will be perhaps magnets or flyers or things that you can hand out to your retailers. So it's a great excuse to go and visit with retailers and hand them the materials so that they can share it with their staff and have them get on the module and go through it and then print off their certificate.
And we're going to be, we developed a piece because Golden has several different laws. So we developed one piece that is what businesses need to know about the sale and use of tobacco. So it covers smoke-free laws as well as retail licensing. And then we took Mike's poster and we're going to make some changes to that, just that are specific to, he's excited, to their law, and laminate it and distribute that to all the retailers. So thanks, Mike, again.
Yeah, we had a lot of help with that. Actually, Kristen and another lady, I can't remember her name.
Grace?
Yeah,
Grace Lynn?
yeah, she had a lot of help with that, helping us with that too.
Yep.
What I really like about that is that you guys put that in the break rooms. You use that as a tool, it's right alongside of the minimum wage sign, kind of, it kind of gives it some importance. So that's great the way you guys have used that to educate.
Can we all get a copy of that?
Is that on the Grantee Google website? A copy? I'm not sure.
I couldn't find it when I went to look for it, so I just asked Mike directly. So it might not be there.
And it prints off in what size? It's fairly large, I remember.
Yeah, we're resizing it. We're going to make it more, I think 11 by 17 or something like that.
Okay.
So Mike sent that to me yesterday. I'd be happy to drop that onto the Grantee Google website for folks to access.
Yep.
If that's okay, Mike. Yeah. Okay.
All right. Anything else from the field? Anything else you want to share with your partners here? All righty then. Terry, do you want to do share screen and we'll get into the key messages? Have you guys had a chance to look over the key messages, and has anyone actually utilized some of the key messages?
Yeah, we've used it. We've distributed it with our adult coalition in Brighton and gone over it in our last 3 meetings or so. We've gone over the key messages. And so far they've been really nice and certainly something that is easily adapted to the individual community and community concerns. So yeah, we've been using it and we like it.
Good. Can you try share screen again, Terry?
Yes, sorry. I'm working on it. Hang on.
Okay.
Why? You have
You play with your Legos.
Okay.
All right.
Sorry.
anything?
It's take your kid to work day for me today.
Mhm.
Okay. So if you want to just scroll on down. So what I think one of the important points to make with the key messages is that first or that second, bolded sentence that Terry went by that said that you can use these key messages, the essence of these key messages within the talking points and within your communications. And for Mandy and Eagle, she's going to be presenting soon to Aspen and had developed some key messages, some talking points for her to share to in support of what Aspen is doing with their tobacco retailer license. And so I made sure to pull some flavor from the key messages and incorporated them into what she's sharing. So it's nice that we're all using similar language. You certainly you don't want to take the key messages and use them verbatim, but the essence of them and the main points that they make are what you would want to use. And you don't use all of them. It depends on who you're presenting to and what their values are and what angle you want to approach them with as to which messages. And as we've talked about for a long time, it's important to make sure that people understand the problem, that you don't just jump to talking about the importance of licensing, because often we find that turns them off, or they're totally confused and they don't even quite know what a license is. So to really focus on the problem at the point of sale with youth access to tobacco and what we mean by youth access, that youth are able to purchase tobacco when they attempt to in many communities, and that retailers are not receiving the compliance checks that they should be receiving. So you want to build your audience's readiness, which then promotes eventually their political will, and you build their readiness by educating them on a problem and make sure that they have understanding and awareness of it before you move into talking about solutions. So moving on down, and you guys interrupt or ask questions or make comments at any time, please. So we went, and there was quite a large team of us who worked on the key messages, from people at School of Public Health to the State Health Department to SE2. We all played a role in we revised and considered caveats and but what about this? And we refined the problem down into 3 main points: that Colorado youth are using tobacco at alarming rates, which we've seen, especially those electronic cigarettes, those vaping products are out of control, that retailers are selling tobacco to kids even though it's against the law. And based on the Healthy Kids data, more than 68% of youth who attempt to purchase can complete the transaction. And the compliance checks are only happening with about 50% of known retailers. So those are the 3 main points. Youth are using, youth can purchase, and retailers are not being adequately held responsible. And then we broke each one of those nutshells down even further and provided you the nutshell again, and then supporting evidence or evidence to support that nutshell. So with this first one, Colorado youth are using tobacco at alarming rates. We acknowledge the fact that really cigarette consumption is going down, but it's these new novel products that the industry is using to hook kids. We're seeing that in nationally and in especially in Colorado, they're successful. That youth use of these products is on the rise. Does anyone have any questions or comments about this first main point? Do you find it's a salient point to make?
I think it's definitely a salient point, especially with respect to the e-cigarettes. Mm-hmm. And I'm wondering, what are the 68%? What are the actual numbers behind that?
Well, that's Healthy Kids data from 2015. I would have to go back in and look up the specific numbers. How many tens of thousands of kids does that represent? Jill, do you happen to know that?
I was just thinking the same thing, that we would have to go back, and I'll see if I can look that up now. I'm not sure that it gives us, I don't think we get actual numbers. We get the reports, so it would have to go back and to the original data and have the university pull that for us. But it's sampling across the state, so it's not, we didn't ask every teenager who smokes.
Right, but it is
of those who completed Healthy Kids.
Right, it's of those who participated in Healthy Kids and not just of those who were specifically answered the question, yes, we smoked. We just learned that, I don't know, 3-6 months ago, something like that, or actually less than that, a couple of months ago. It was relooked at, that data was relooked at to make sure that, how large of a statement that we're actually making on that. And Joe, correct me if I'm wrong, the email that came back out said that what we are looking at is amongst those who participated in the Healthy Kids Colorado survey, and not just of those who smoke.
Right, exactly. And it's also, remember that Healthy Kids is divided into, right now it's divided into 2 different
like modules,
if you will. So it's everybody who answered the question in which the module in which that question is asked. So it's not, so that the number, we can look it up and how many on that module said that, but I'm not sure that gives us, information that we can use.
Thanks. It's really useful to have all that background information.
Mm-hmm.
I'm thinking more in terms of if I was asked the question while I'm presenting or speaking to someone, would I be able to answer it?
Good. Okay, good. Yeah. And that's a good thing for us to keep track of. And what are the additional things that you need, the background information, so that you feel prepared to use these.
Mm-hmm. Yeah, I mean, sadly, Healthy Kids Colorado is not even done in some of the communities, some of the counties where we have licensing, like Jefferson and El Paso and up north. But the numbers are statistically significant enough so that they can project that number onto the percentage of youth in Colorado. Let's see, what else? So there's the acknowledging that while cigarette use has gone down, which is a great quote because it supports those communities that want to stick with non-cigarette tobacco. Yeah, non-cigarettes, the consumption among youth has gone down, but it's that non-cigarette products, the non-cigarette products such as electronic cigarettes, where we're seeing quite a rise. Let's see, among Colorado high school students, the use of e-cigs has surpassed every other tobacco product, even cigarettes. So we're really trying to drive home that e-cig bit. And let's go down a little more. And then there's a lot of Healthy Kids data in there. And then in a national point, the final bullet from 2013 to 2014, national use of e-cigs tripled. Oh, and that's the point Terry likes to make, that 1 out of every 3 Colorado high school students who use e-cigs have never tried any other tobacco product before. So they could have been anti-cigarette kids, but they think these products look so cool, I want to try them. That next point is one, we always make that drives home the point that the tobacco work we're doing is it's a youth health issue, that 90% of adults start, before 18. And then there's a figure that you might be interested in, Amy, about each year more than 2,400 kids under 18 become new daily smokers. And we could even do some sort of social math around that. What community in Colorado has a population of 2,400? Something like that.
Yeah, that would be cool. I assume that means smokers of traditional tobacco products.
Yes. Cigarettes. Let's see. And then getting into the bit about, everyone knows that, or pretty much everyone knows that nicotine is addictive. So, but specifically to youth, what makes it even more harmful is that the developing brain is more susceptible to addiction than the adult brain. So youth become addicted more heavily and more sooner the younger that they smoke. So those 2 points right above number 2 are important. Especially if you're talking to people who work with young kids, people who are focused on youth health, mental health, talking about some of these points around the teen brain and the damage that nicotine can do. So the point for number 2, retailers are selling tobacco to kids even though it's against the law. And more than 68% of youth under 18 who attempt to buy can purchase. So that is based on a sample that is then projected to the state. It means the state law is not working. And we just saw another instance of that in Golden. Keeps popping up in Golden. When we do checks, we find that there are people who are not following the law.
Kristen, can I jump in on one thing here?
Please do, yes.
One thing that I see is really important is this, and it's retailers are illegally selling. We intentionally chose that wording rather than kids are able to purchase. The people who should be held responsible for this is the retailers, not the kids. We don't, so I think you've all had issues or have heard about stories about decision makers who want to strengthen minors in possession ordinances. And we're really trying to turn the attention to it's illegal for retailers to sell, but they do it anyway, rather than punishing kids.
Yeah, and that's depending on who I'm speaking with. I've tried to make that point before, where I did with some of the city council members down in Colorado Springs at a meeting that someone asked me about, well, what about the kids? Why aren't we focusing on them trying to purchase? And so I gave a little bit of information on the tobacco industry, this multi-billion-dollar conglomerate that has, fancy advertising and promotional campaigns that make tobacco that are appealing to youth. They are trying to hook youth and they are successful. So it's really ultimately the industry that we need to focus on and their tactics, and not the victims, which are the youth.
I'm wondering that for the retailers who are illegally selling, are we still finding that it's more the mom and pop places than the large, chain outlets?
No, it's, I wouldn't even say it's 50-50. From some of the data I've seen, it seems more in the chains is where we're seeing the violations. I mean, we had a violation in a Walgreens. We had a violation at a Circle K. Tracy, do you know where your most recent violation was? Did we lose Tracy?
No, I'm here. Sorry. I had to unmute.
Oh.
This one was Loaf and Jug. So
Yeah.
It is the chains. And yeah, it was Walgreens before. And the last violation, FDA violation in Edgewater, was King Soopers.
Yeah. Yep. Good questions. All right, let's keep going down. So compliance checks are essential to ensure retailers are not illegally selling. And I think communities support compliance checks around around alcohol. I've known a bunch of bars and restaurants that can't sell because they failed the test. So we need to do the same. We need to hold tobacco retailers to the same level that we're holding alcohol retailers. And I can only imagine how strict they are with marijuana.
Just a point on that, Kristen, that came up in the Brighton community because they had some violations on the alcohol side that they had really targeted as a council to really go after, and had their police chief really make that a priority for the department. And that has kind of blossomed into an opportunity for us to say the same is happening with tobacco, and it should also be a priority for the department.
Excellent. Thank you for sharing that. Yeah, I mean, you hear things like that they may mention in passing, and that's the perfect thing to jump on, to keep those ears open, to find any angle you can to say, well, we talked to you about another deadly product that you need to make important, just as important as alcohol. So then there's this one with the compliance checks references the Fort Morgan study that Arnold Levinson and his team did. And then this citation about tobacco retail stores in jurisdictions with weaker enforcement are more likely to sell. So you can always pull up those citations and read more into that. And then after you feel people really have bought into the fact that, yeah, we acknowledge there is a problem, then you moving into the solution. In a nutshell, there are the three primary areas that, and this is where I think SE2 is taking a lot of their campaign materials, right, Terry, that compared to things like marijuana and alcohol licensing, tobacco, that the fact that we do license some things in Colorado, but what has fallen through the cracks is tobacco. But compared to those licensing schemes, which have very high licensing fees, tobacco. What? Oh, I thought someone asked something. Tobacco retail licensing is a low-cost way to reduce the high cost of youth tobacco use. I mean, the average right now for our licenses in the state is $142, I believe, compared to it's upward of $1,000 or more for alcohol and marijuana. Does anyone know what marijuana licensing is? I don't remember.
I think it depends on the jurisdiction.
Yeah, but I think they're pretty high.
And expensive, yes.
Yeah. So number 2, licensing is a common sense approach that will ensure retailers operate legally, ethically, and responsibly. Seeing that happen in Fountain and Golden for sure. Local licensing of non-cigarette tobacco retailers in Colorado successfully supports strong enforcement and reduces the number of illegal sales to minors across the state, from communities that looking out a year pre-license to a year post-license, we saw a 76% reduction in illegal sales, and that was pulled from Counter Tools, which is based on DOR data. It is not based on the local compliance checks, not yet. So let's see, some of the details down there in the solution, down just a little bit, there you go. So let's see. These are some important points, and this really gets into the impact on small. You'll hear about, and this is going to impact our retailers. This is going to hurt their bottom dollar. It's going to make it harder for them. Important points to make that they pay a small annual fee, which is often covered by the tobacco industry for them, which is not in here. It funds local administration, retailer education, which includes that online module, which should be available late summer, I would say. The average cost of a license is about $150 a year. It's actually just slightly less, which is a small sum compared to the alcohol licenses. And Colorado retailers report earning an average of $18,000 a month on the sale of tobacco. So when you look at them making $18,000 a month, $150 a year is nothing.
You know, Kristen, I actually, that statistic always just sort of blows my mind, you know, when we start talking about, you know, because key decision makers, you know, those folks, you know, when you start talking money, they start perking up. You know, one conversation that I've had with some grantees, and you've probably had others similar to this, is that looking at 18,000 as an up to amount, given the fact that, you know, if you're moving into a small community that doesn't, and where you have no retailers who make $18,000 a month, that it potentially could also be a kind of a deterrent for a city council to really say, oh, wow, so it's not really a burden upon these guys. And Kristen, have you had any conversations with anybody who's working on these key messages similar to that?
No, but I would say, and this data is from I know it's from some Greeley data, and I can't remember the other community, but It's from the surveys done with retailers where you go in and you ask them a couple questions about how do you train your staff, how much would you say you make from the sale of tobacco. So based on that data, we found the average figure. So for a smaller community, it would be nice to go in and do those surveys with your retailers, and then you can speak specifically to the average amount in our community that retailers make from the sale of tobacco is, I think La Junta, maybe Mike, your data played into this because you had data as well. So this, I think, is based on La Junta and Greeley data. I have to look down in the, oh, we just say compiled from Colorado cities because we didn't, from 3. So I think one is La Junta, one is Greeley, and I can't remember the other one. It might have been Fort Collins.
And so you may know that FC2 is working on some fact sheets to go along with some of these. And in that one, we did modify this statement. I haven't seen the final product of it, but I did an edit to say some Colorado can report up to. I talked with Rachel and Well to kind of get a little bit more information on this because I know that if you've got mom and pops, if you're a small community, and I don't want you to say something where you could lose people because they would be, this doesn't match our community, and so this was from a survey. According to Rachel, a smoker friendly is the one that reported that much, and so I think some of it, like just kind of like what Kristen and Terry are saying. Use it in a way that fits your community.
Right. And well, I think a smoker friendly, I think someone had some report as high as like 35,000 a month. That might have been the smoker friendly in Greeley. But I think going in and doing surveys with your retailers and finding out what the average is in your community, and then customizing this point to say on average retailers in our community make around $10,000 or $5,000 a month from the sale of tobacco. So a license fee of $150 is a drop in the bucket.
Right,
I'm just,
right.
sorry, Terry, I was just going to butt in for a sec. I work with Rachel in Weld. It's Kat. And our average revenue was $5,000 per week. And then it ranged from 50 to 20,000 per week. That's what we got from the Greeley survey.
Yeah.
And the point here really is to support that that a non-cigarette tobacco license is a low-cost way to reduce the high cost of tobacco use.
Exactly.
So, I mean, you could say, you could look at, what really is the cost of, of a lifetime of addiction, disease, and death, compared to the $150 average of a license, or, the $5,000 a month, that a retailer. So it's meant to build the case for the main point, but to Kristen's point, also, get into your data, understand what your retailers are doing, and how that's impacting you. So.
Well, and Mike and Donna, I didn't in your burden presentation, you had your specific community data. You said retailers are making around this much a month in La Junta on the sale of tobacco, right?
Yes, we did.
Because I thought when you shared that with council, or whoever the group was, I thought I saw some eyebrows go up because people don't really have any concept. They just think, oh, we don't want to charge retailers an annual fee. So.
The industry does coach people to talk about this fee as being a significant burden.
Yeah.
So
No.
you can't expect that.
Right.
Right.
We've had, in our situation, we've had 2, possibly 3 retailers that is like a couple of liquor stores, and I think there was a gas station or a mom and pop type gas station, not a chain. They sold such few amounts of non-cigarette products that they decided rather than pay that fee, they would just not sell anything but cigarettes. And so we've had that happen as well.
Good.
A new twist.
Yeah. So then the second point under solution is the whole common sense approach to ensure retailers operate above boards. And then there's the bit about in Colorado, you have to sell, state law requires license to sell goods and services ranging from marijuana and alcohol. And then locally is ice and Christmas trees. These are being changed some in SE2's talking points to focus on a blanket statement that reflects state law, because not all communities require a license for ice or Christmas trees. However, there is no license required to sell tobacco, which is the deadliest consumer product. Kills 1 in 3 of its users. Imagine if Yoplait yogurt killed 1 in 3 of its users. So, let's see. Some other points to make. Colorado is only one of 10 states. I fought hard to say one of a handful, because that number, you get slightly different numbers from 8 to 12, depending on who you reference and who you talk to. But basically, we're one of the few that doesn't have a state license. I really don't, I know people like to make that point. I don't make that point very often, because then people say, well, why doesn't the state do something about it? Why don't we have a state law? Because then you get down in the rabbit hole about, well, the tobacco industry is very influential over our state legislators, and we have not been successful at fighting them, and so we're focusing on the local level, blah, 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 blah.
Parenthetically, I wonder if there would be a way, I know there's a website, it's called Money in Politics or something, that lists contributions and where they came from. I wonder if it'd be a way to ever compile a list of state legislators who take money from tobacco companies, and actually that might or might not be a good idea. But
Yeah.
Amy, that's a good idea. I'll suggest it to our alliance.
I know Wendy and I have looked at that for certain when we're thinking about certain state legislators. We pulled up to see who gives to their campaigns, and it's often the oil and gas industry, Greer Bailey and such, which is the sort of the cover for, or the larger organization for the tobacco industry.
because that's convenience stores.
Mm-hmm.
Yeah.
But that would be a great thing for the Alliance, and maybe the Alliance has done some of that. Who knows?
I just wonder, I don't mean to be the devil's advocate exactly on both, but to argue the other side of the issue, would it alienate people who we might want to have on our side in some other way, even though it's factual information about
Right.
where contributions come from?
I think it's important to think through all sides of it, Amy. So yeah, it's good to ask those questions.
I ran across a report out there in the online that actually looked at tobacco contributions to state legislatures, and it was done within the last 10 years, and it was done by one of the universities out of California. And I don't know who commissioned that, but that's out there. That's out there in the world. So.
I mean, at the federal level, you will see a few examples of Altria, or which is Philip Morris, or Reynolds American contributing to federal legislators. But at the local level, it's not as clear. You don't actually see the names of the tobacco corporations. You see more of the organizations that are front groups for the industry. So let's scroll down a little bit more. I like that point. Above 94% of Coloradans believe if a store sells tobacco to a minor, it should have its license suspended. So basically all of Coloradans support that. I know a point that they made heavily in La Junta was that they didn't know where people were selling, because in La Junta they found a lot of non-traditional vendors, from the Halloween shop to some auto parts store. So they talked about, if we had a local license, we would know where people are selling. We would know where to go and check. So bucket number 2, local licensing successfully supports strong enforcement and reduces the number of illegal sales. So there's a lot of points underneath of that support that statement. There's the 76% reduction that I talked about earlier in point 1. Some city council people have talked about how they don't feel it's their role, that it's becoming a nanny state, etc. But actually licensing is an appropriate role for local governments, as they are responsible for health, safety, and welfare. So in some politically correct way of reminding them of their role is that second bullet. And let's see, the third bullet, in Colorado communities where licensing has been formally presented, city councils have unanimously passed a tobacco licensing policy. And sometime soon, we'll be able to add, where it talks about Edgewater, approved requiring a license to sell cigarettes and all tobacco products. Hopefully after June 12th, we'll be able to add Aspen into that.
And it looks like we may not have written La Junta in. It actually hadn't passed prior to this being completed. So we'll make sure that that gets on the list as well.
Yep.
We also have Rocky Ford there too. This should be there.
Rocky Ford might not have been unanimous. That might be why it wasn't included.
Oh, okay.
I think there was one dissenting vote.
You're right. You're right.
Okay.
All right, let's scroll on down.
I think whether unanimous.
That's it.
Yeah.
Go.
Yeah.
Go ahead, Amy.
Whether unanimous or not, it's still good to know every place in Colorado that has a license in effect now.
Oh, yeah. Yeah, and we have that chart that lists out all communities that have a license, what their fee was, when it passed, when it became active. I think that's on the Google website too. That's always a nice document to leave behind for someone to look at. And it's exciting that that document keeps growing. All right. Anything else anyone wants to bring up about the key messages? I hope this was helpful.
Kristen, can I jump in there just right quick?
Yes.
As I was thinking through some of the conversations that you and I and SC2 and other state staff had talked about were we have an addendum document that goes with this, so that when we find new points that are important to make, new research comes out that increases sort of the point that's trying to be made. We move those to sort of this holding document, and then we review those, and then we upload these, either changing or adjusting to these messages as we go. So it's somewhat of a living document, but it's not as real time often as. So, for example, the La Junta passing, is not as real time. So it is reviewed. They are uploaded in there. There's two that I can think of right off the top of my head that are probably on the list at this point, or at least should be. One is the 4.78 times more likely to smoke a year later. That evidence that's coming out around the e-cigarettes and middle school. Is it middle school or high school? Their use. And the other is that I know Arnold presented at the Tobacco Review Committee that they do have a percent from the TAS data. They do have a percent of adults who support licensing, and so we'll want to add that at least to the holding document, and then we can all sort of make some decisions around that as well. So just wanted to let people know that we're thinking about these other elements as research comes out, and how to get those into these key messages in a way that's useful.
So Terry, do you have a screen share with the SC2 documents, or is it just something verbal you're going to share?
I don't have a screenshot of that document, but it is something that is available kind of internally for us. So if this isn't in there, it will soon be in there as updates to consider.
Okay. Do you want to unshare screen and then we can just all see each other?
Yeah. Sorry.
And you guys have a choice of view options. You can do gallery view, the Brady Bunch view, or you can see the person who's speaking.
Yeah, so something else, Kristen, that I heard you say in there was, when we transition from problem statement into the solution statement, and you mentioned, a community that is sufficiently prepared or sufficiently understands what the problem is and is ready to explore the solution. And I'm wondering if, for those who are on the call, or how did you know? How did you know the communities were ready to move from problem to solution? Focused messaging.
Terry, I think we really just knew based on our key informant interviews and our power mapping activities, really seeing that we had an audience in council that the majority of the members were sympathetic to youth protection causes. And that was really what kind of drove us to the point where we said, yes, this is absolutely viable for our community. The key informant interviews were obviously biased because we were doing a lot with schools and with youth serving agencies. So we weren't really connecting much with retailers, and that would have been kind of our first missed opportunity in terms of assessing our environment and our readiness. Would have been to connect earlier with businesses. But so far through our interactions with Chamber and with a couple business owners, it's been pretty positive. So it was really just based on that and really getting into the people in your community that understand your community. Obviously, we didn't have as big of a grasp on our community until we really started working with people like our champion and people like the community leaders that we've connected with. And that was really what gave us the best idea that they were ready.
We also did some background research on council members, and their biographies indicated that they're all very youth-oriented. As they have worked in the school district or had some interaction with the school district, and the community itself is very youth-oriented.
Great.
That was a good question. So Terry, do you want to get into, we only have 10 minutes. Do you want to talk about SC2 and what's coming down the pike? I think you're muted.
Oh, yes, sorry. Yes, I'm saying I was getting to the email right quick. So let me just start off by saying that this is the retail licensing campaign that we sent out, I don't know, 3 months ago, where there was an actual vote on 3 separate campaigns. And the campaign that was selected was by everyone was the one that talked about you have to license this, but not this. That comparison. Kristen mentioned during as we were going through the key messages that the ice and the Christmas trees were both local licensing, specific to locality and could not be therefore used globally with all of this. I mean, we had to go to a state specific license to be able to make the comparison and use it across the state. So anyway, so that reseller licensing campaign and the toolkit. That's what I wanted to talk to you about, a little bit about what's in the toolkit and what's going to be available to you guys. So these materials will be available on the grantee Google Drive. First of all, we have the key messages. Then, as an accompaniment to that, we have 3 fact sheets that will be coming out. The first fact sheet talks about curbing tobacco use by cracking down on illegal sales, and to give support documentation around that. We have the second one, which is stronger laws protect youth, and then protecting kids is protecting business. So there's going to be 3 different fact sheets with these 3 different themes, if you will.
I learned that it was still.
Another toolkit item is going to be the frequently asked questions document. There'll be a sample op-ed, there'll be a sample press release, there'll be story ideas, and then there'll be an infographic. So these toolkits will go alongside of the campaign, and the printed materials will be available on the cohealthresources.org site. The digital materials will be available on the Google Drive. So I want to talk a little bit about the retail campaign. The retail campaign has 4 different executions, is what they're calling it. First of all is comparison tobacco to meat. You have to have a license to sell meat. What about, but not tobacco, fireworks, eggs, and a dance hall. And the neat thing about these is that there's kind of some interesting remarks about each of these in a little commentary box, I guess, at the bottom of these. So they're kind of neat. They're actual facts, but they're also they make a play on the fact that you need a license for this, but not that. The timeline for these, the campaign and toolkit materials will be released at the same time, and all materials should be launched and available for use by mid-July. So me talking about this wasn't meant to be sort of the end-all be-all around this information. So more to come as these roll out. There'll be follow-up communications that'll go out to all Goal 3 grantees. And then also, if you have additional questions, you can obviously contact Allison Neipert at SC2 Communications. She's said she would be happy to speak with you regarding the toolkit, the retail media campaign, how to best utilize this this campaign, depending upon where you're at in your policy continuum. I think that depends on that actually is probably the bigger. That's probably the biggest thing here is to make sure that you use the right campaign or key message materials at the right place and time. So that's all I have on those. Are there any questions from you guys? Great.
And so I'll just add that we're pleased to be getting items that coincide with the policy topics that you're working on, and we've I think they understand that we need more that supports the policy things along the framework or along the continuum. to help prepare your community early in the process, and we are looking to get more of that from a retailer perspective as well as smoke-free, just to say that that's some of the next stuff that we hope to see in the next year too.
Yeah, as a way to do that, you know, your POCs, your point of contacts, have reached out and asked for community-created media, and that information be plugged into a Google Doc, and then we can look at any of those pieces and say, well, this fits perfectly in the investigation stage of policy, or you know, whatever stage that would make the most sense. So.
Yeah, and to clarify, SE2 in their contracts, we're charged with doing cessation resources, and it's taken some behind the scenes work to be able to get it set up so that we can get media that supports policy, and so that's why we're just now getting that, and we're looking forward to seeing more media that's consistent with the community policy work that you're doing. So and we also know that people have done some really great stuff, and so we want to get that and to be able to share that.
Yeah, like the La Junta poster is a great implementation and compliance supporter for that, one of those late phases in the policy continuum. Terry, did you mention about, I blanked on some of it, sorry, the customization abilities with this campaign, that you can put your community's name into the flow of some of these documents?
I didn't mention that, and I don't know.
Oh, hopefully.
If it's going to be templated like that,
I know it came
I can
up.
find that out.
Yeah, that'd be really important.
Yeah. Sorry, I didn't ask that.
Okay. All right. Anything else anyone wants to bring up or share or talk about on this call? We are not going to have one next month. We're going to take a break, and we're going to start in August. And I'm going to be sending out an email hopefully before I go on vacation, June 21st. I'm gone for 2 weeks, by the way. So if you're thinking about, oh, I need to ask Kristen something, or I need something, let me know as soon as you can so I can get back with you. But I'm going to be sending out an email to find out what sort of topics you would like to hear in next year's grant cycle, learning community calls, or the quarterly calls. Which really quarterly, you know, we were going to do an hour, and then in between they were going to be check-ins, but sometimes the check-ins are an hour and they're important. They've got important information to share, like Eric Brodell from Tobacco 21 at the last call, which has been recorded, and it is on the Grantee Google website. For those of you who didn't hear Eric's presentation on Tobacco 21, what it is, why, and how you do it, that is in the Grantee Google website, so you can go pull it up and look at the recording.
I'll just say that was a great presentation, thanks. And also thanks that the materials from SE2 are going to be more oriented towards policy. That will be really helpful, I think.
Amen, Amy. You are right. All right, anything else, anyone?
Kristen, our Lakewood Coalition meeting is on June 27th, so I'm afraid you'll have to come back on that day.
Okay, I'll fly in just for that meeting, and then I'll fly back.
Okay.
Or maybe I could call in if you need. Just, you have my cell phone, so just.
We'll be fine.
Because that's not work. That's my personal life. So, you know, let me know.
Right.
If I don't have anything going on.
And good luck to Mandy on Monday.
Yeah, Mandy, rock it, girl.
Yeah.
All right, everyone, have isn't today Thursday? Mm-hmm. Yes, we're almost there. Hang in there, keep working, and everyone have a great weekend.
Thank you.
Bye.